How is antibiotic resistance impacting UTI treatment? Imagine a world where the medicines we're relying on to clear infections no longer work as well. That's what antibiotic resistance is doing to urinary tract infection treatments today. It's a growing concern because bacteria like Escherichia coli, which cause most UTIs, are becoming resistant to many of the antibiotics we usually use. This includes drugs like trimethoprim sulfamethoxazole, fluoroquinolones, and even some last resort options like carbapenems. When bacteria develop resistance, it means the antibiotics can no longer kill or stop their growth effectively, making infections harder to treat. Traditionally, doctors prescribe antibiotics such as nitrofurantoin, ciprofloxacin, or trimethoprim sulfamethoxazole to treat UTIs. These drugs work well most of the time, but overuse and misuse have sped up the development of resistant bacteria. For example, when antibiotics are prescribed without proper testing, or when patients do not finish their full course, bacteria can survive and adapt. The use of antibiotics in agriculture also contributes to this problem. As bacteria become resistant, standard treatments often fail, forcing healthcare providers to turn to alternative options that may be less effective or have more side effects. This resistance creates several challenges. First, there are fewer effective antibiotics available, which means doctors may need to use drugs with more risks or higher costs. Second, treatment must now be guided by local resistance data, so doctors know which antibiotics are still likely to work. Third, infections caused by resistant bacteria often requiring longer or more complex treatment plans, sometimes involving combination therapies. This can increase the risk of side effects and make recovery more difficult. Patients with bladder health issues or bladder cancer are especially vulnerable. Their immune systems might be weaker or their urinary tracts more prone to infection, so resistant bacteria pose a bigger threat. Infections can worsen bladder irritation or delay cancer treatments, which makes managing UTIs even more critical in these groups. That's why antibiotic stewardship, using antibiotics carefully and only when necessary, is so important. It helps slow resistance, preserves the effectiveness of existing drugs, and protects bladder health. In the end, combating antibiotic resistance involves a combination of responsible prescribing, accurate diagnosis, and ongoing surveillance of resistance patterns. It's essential that healthcare professionals and patients work together to use antibiotics wisely. If you suspect a UTI or have ongoing bladder issues, always consult a healthcare provider for proper testing and tailored treatment. This way, we can keep antibiotics effective and safeguard bladder health for everyone.